winter is coming. Now, we see a lot of elderly people with severe dryness in your legs, especially close to the winter time. Let's say if you're in and around Bangalore, normally this period of, let us say, between November, December, Jan, Feb is a quite dry spell. And Bangalore weather is generally less humid, so a lot of dryness in the air. And we have a lot of elderly people who have settled down in Bangalore, again because of the weather. So dryness is a very common phenomenon, and most of them don't come with dryness per se, but they come with complications of dryness. Now, here are some simple tips, or let's say some medical advice on how to maintain a dry skin. This is useful for all, but especially directed towards elderly people and people who have diabetes also. Now, what happens is, in case of extreme dryness, especially in the legs, because of the dryness, we may not notice. Let's say we are talking to somebody, our hand silently slips down and we scratch ourselves. And let us say while sleeping, we may use the other leg to scratch ourselves, and probably that gives a temporary comfort. This leads to a breach in the skin and then leads to secondary infections. Since, see, with age your immunity goes down, skin barrier also goes down, and even the turgor, or let's say the skin elasticity, all those things also come down. So the breach of skin is much more easier or much more faster in an elderly person. Now, how do you maintain this? You must have heard of plenty of doctors, dermatologists, plastic surgeons. Many of you recommend applying moisturizer. Again, this is the golden rule. Applying moisturizer is one of the best ways of reducing complications related to dry skin. Now, let us say what are the other home remedies you can do apart from applying moisturizing creams. Now, let us say example, castor oil usage. Castor oil is one of the excellent emollients that is available. Again, there are multiple brands. Ideally, now you have this cold pressed oil that smells a little less, and processing is done reasonably well. So castor oil, ideally you apply it, let's say you get up in the morning, you apply the castor oil, let it dry off for a couple of hours, and then you take bath. And the frequency which you do it, you can decide on it. Normally I recommend at least once or twice a week minimum to keep the leg healthy and supple basically. Now, let's say some people I use coconut oil. Coconut oil is a very fast drying oil. You apply it within, let's say, a couple of minutes, or let's say maximum 10-15 minutes, it may dry out. So coconut oil alone is not enough. You need a thicker variety oil. So let's say a mixture of coconut, castor, and probably even almond, a little bit of warming it up, and our traditional ways of, let's say, adding some amount of herbal leaves also play a part. I'm not sure how effectively, but they do play a part. Next, applying it, as I told you, couple of hours before bathing, and then washing it away. An important fact is, when you wash it away, don't apply soap rigorously on that area and try and wash out all the oil. I suggest most of the elderly people don't apply soap on your leg, or let's say below your knee, don't apply soap at all. Whatever soap you apply on top part of the body when you're washing it off, that will help in washing out the dirt below. Yes, specifically your feet you need to wash, and you need to cleanse it up properly with soap, definitely. But legs, I tend and ask them to avoid washing their legs with soap. If you have to use soap, probably a liquid soap can be used. Now, these factors keep skin integrity intact and help in prevention. That is the main symptom. This will reduce the burden of you visiting multiple doctors because of some leg issues, and at the same time keep your skin healthy. Hopefully this was useful for your winter care. Thank you.